Hello and welcome to Mental Health Matters. I'm Edgar Wiggins, your host for this program that is dedicated to providing you with practical and useful information regarding mental health and related issues. All communities and groups experience mental illnesses. However, African Americans and other minority groups' experience of treatment can be problematic. Today, to help us begin to understand this very complicated issue, is Dr. Annelle Primm, who is the Director of Minority and National Affairs for the American Psychiatric Association. Dr. Primm has been a practicing psychiatrist in the Baltimore area for 22 years, and she is also an Associate Professor of Psychiatry at Johns Hopkins. Welcome to Mental Health Matters, Dr. Primm.
Thank you, Edgar. My pleasure.
Let's begin by kind of looking at the issue of just help-seeking behaviors in the African American community. Are African Americans as likely as other groups, if they're experiencing a mental illness or a mental health problem, to reach out for care? And if so, where do they go?
Well, African Americans are less likely than others to seek mental health services. There are many barriers, stigma, sometimes people wanting to go to what we call alternative sources of care, like the faith community. That's a place where people have a lot of trust and may be the first place that people go when they are experiencing mental health needs. Some also go to the primary care setting, to their family physician. Some go to emergency rooms, which, as you know, is not the best place to receive one's mental health care.
Well, and also going to an emergency room also means that you've really waited until the situation has become a real crisis, and there are very few alternatives.
That's right, and when people wait to the crisis stage, we know that their outcomes, or how they ultimately do, is not as good as if they had come for services much earlier. There really is almost a window that we really want to get help at a certain point in time in order to get the best outcome. And if you wait beyond that to the crisis stage, then we really missed an opportunity for the person to do as well as they possibly could.
Well, let me just go back, though. You talked about stigma. Let's talk about that a little bit more, because I really do think that that's an especially difficult problem for the African American community. I mean, we're certainly aware that there still is stigma regarding mental illnesses and treatment and so forth, but why might stigma be a special problem for the African American community?
Well, for African Americans and other people of color, just being who they are in terms of their racial and ethnic background is stigmatized. People are looked down upon, they're devalued, and so, just based on their race and ethnicity. So when such an individual then confronts having a mental illness or a mental health need and perhaps being labeled as crazy, quote unquote, this is another stigmatizing label placed on them, and we've called this, double stigma. Right. So it certainly does not encourage people to step forward for services or be known as someone who needs mental health care.
So it really is a particularly difficult problem, and in fact is a barrier to reaching out to get help. Now, you talked about going to the faith community, to our ministers, pastors, whoever.
Yeah.
You talked about going to our family practitioners, healthcare providers, but you really didn't talk about going to a specialized mental health clinician, a psychiatrist, a psychologist, a social worker. What really is the issue in terms of African Americans seeking out specialized mental health care?
Well, just walking through that door, usually with our community mental health centers is a big sign that says Community Mental Health Center, and anybody seeing a person walking in there assumes that, they have mental health needs. So again, it gets back to that whole stigma issue. And, walking into a church or another religious institution, walking into a primary care clinic, you could be being treated for any number of different things. So it's sort of a safer zone or safer door for people to walk into. And, for some of us, we've been thinking that our strategy should be, as mental health professionals, to link up with those alternative sources, the primary care setting, the faith community setting, so that we can be there and sort of provide a mental health specialty safety net in those settings, since that's where people more comfortably and more naturally go.
Well, the thing that I, of course, was thinking about is if you're going to somebody who's not an expert in that area, how likely are you to get the kind of help and care that you really need? How likely are you to get the help, the specialized treatment? And one of the concerns that I have as well, and since we're kind of talking about some of these issues, is what's your sense of how accurate the information is that the African American community has about mental illnesses, about treatments, about what causes the illnesses, and that sort of thing?
Well, I think the information, there is information that's out there, and there are lots of advocacy groups like Mental Health America and the National Alliance on Mental Illness, NAMI, and even some of our local organizations, the Black Mental Health Alliance and so forth, that have put together pamphlets on mental illness and so forth. I'm not sure how deeply into the African American community that information has traveled, and I think most African Americans at this point learn about mental illness by word of mouth, and there are lots of myths surrounding it, and I think a lot of misinformation that still gets circulated. So that's a real problem.
Well, that's my concern, and one of the things that I've noticed, especially at some of the NAMI gatherings, is that there are very few people of color who are involved in those educational meetings and forums. I mean, occasionally you will see a few, but in my experience there tend to be just a handful, if any. And I'm always concerned about the degree and extent to which people have access to accurate information. I mean, it's great if we put it together, but if it's not getting to the community, then the myths don't go away. The stereotypes remain, and stigma continues to be a significant problem. One of the things that you've done in the past that I think has been very, very helpful is some of the educational videos that you've put together, Black and Blue and Gray and Blue, and these things really did focus on and target African American consumers in terms of this is what depression is, this is what depression is not, and really trying to get at some of those things. But I still think that in terms of really having a major effect on the knowledge base of people of color, and whenever I talk to people, there still seem to be an awful lot of myths and misconceptions about treatment. So what are we doing? I mean, what are we starting to do, at least in terms of trying to get at some of these real challenges? Because I really do see them as challenges.
Well, the educational things that you were talking about, I think using culturally tailored video is a good way of reaching people, especially if you find a location where you can reach populations. And I think churches and other religious institutions are good places because every weekend there's a very large audience, certainly across the Baltimore area, the Maryland area, and really across the nation. And so I think this is a way of reaching a large population of people with educational messages about mental health.
Do you find that churches are open to that?
Some churches are, and I've been very excited and become very optimistic about that approach because of some of the response of the faith community in the Baltimore area There's an organization called the Center for the Integration of Spirituality and Mental Health that Dr. Michael Torres leads, and he's made tremendous inroads in the faith community, in partnership about mental health.
Well, but the thing that we know about Mike is a very unusual individual. I mean, Mike is an ordained minister and a practicing psychiatrist, right?
Yes.
Okay.
Yes, he is, but in being both of those things, he's a really good messenger and a good ambassador, and people in the faith community, they speak the same language that Mike does, and so he's a very important agent in helping to get this message out, and then the ministers and pastors and so forth who then sort of come on board, each one teach one. It can spread from there. So I think there is hope in exploring that avenue.
Well, and I certainly recognize that, and there are some unique individuals there, but one of the things that is, I think, still somewhat of a concern is when we look generally at the practitioners, at the psychiatrists, at the psychologists, at the social workers, the individuals who typically provide mental health care in this country, you're not talking about a lot of people of color, are you?
No, we're not, and that's a big challenge. That's something that we recognize is directly tied to disparities. Many people of color want to see somebody who looks like them because they feel they can have more trust and that individual can have more understanding.
Well, I'm sorry to cut you off, but we need to go to a break. I think we've gotten a good start, but we've got lots more to talk about, and we'll be right back.
Drunk driving doesn't just kill drunk drivers. Next time your friend insists on driving drunk, do whatever it takes to stop him.
The air dances with the waters, which brings the rain that feeds the land, that is home to the animals. All life dances together.
In a world so connected, choosing one environmental cause can be hard. EarthShare is 40 environmental charities working together. You and your company can help by calling 1-800-MY-SHARE.
All life lives, or doesn't, together.
Excuse me, do you wear your safety belt?
Why, no, I don't wear my safety belt.
Thank you.
You could learn a lot from a dummy. Buckle your safety belt.
In our nation of plenty, 1 in 5 children faces hunger every day. America's Second Harvest feeds 23 million people every year. 9 million are children. Help feed a hungry child. Volunteer at a food bank or pantry. Organize a food drive at your school or place of work. Get your friends and co-workers involved. Visit secondharvest.org to find out how you can help. Together, we can end hunger in America.
My hero? Isaiah Thomas, Kevin Costner, Mr. Wong.
These are teachers, but to the kids they've reached, they're heroes.
My hero? Mrs. Wooten. If I don't get through to that child, who knows, maybe no one else will.
Teachers have the power to wake up young minds, to be heroes, to make a difference. Reach for that power. Teach. Find out how by calling 1-800-45-TEACH. Be a teacher. Be a hero.
If all the drunk drivers arrested in Maryland during the past 3 years were here today, this stadium would be full. If you drink, drink responsibly. Remember, drunk driving, it's not worth the penalty.
Welcome back to Mental Health Matters. We're joined today by Dr. Annelle Primm, who is the Director for Minority and National Affairs with the American Psychiatric Association. Dr. Primm has also been a practicing psychiatrist for over 22 years and is an Associate Professor of Psychiatry at Johns Hopkins. Before the break, Dr. Primm, we were really talking about the fact that there really are very few African American mental health clinicians in this country, and beginning to think about and look at what that might mean to someone who's coming in for mental health care.
That means quite a bit to a person, an African American coming for mental health care. Very often people will prefer a mental health provider who was of their same race and ethnicity and may actually have a better outcome as a result. And unfortunately, at this point, there are about 2% of psychologists are African American, 2.6% of psychiatrists are African American, and 4% of social workers. And when you compare that to the percent of African Americans in the population, there's a big gap there. So what that means is that we really need to educate people of other backgrounds to be able to better understand and communicate with individuals across cultures. This is really mandatory, and that's some of the work that my office at the American Psychiatric Association attempts to do, at least to educate psychiatrists from all backgrounds how to better interact with their patients of color, including African Americans.
Well, for the consumer, the client, the patient to feel respected, listened to, and understood is extremely important. And one of the things that we know just about people in general is that, sometimes we are distrustful who are different than us. The idea of training clinicians, certainly about minority mental health issues and cultural difference and all those kinds of things, I would think would be extremely important. But the question that I would ask is, you're talking about training people who many of them already have had years of training. And I would also imagine that you can kind of step lightly around our country's legacy of racial discrimination, racism, bias. Tell me about those training programs and how they might be received.
Well, an important aspect of these training programs is to get people to do some self-analysis, to really look within and assess where they are as it relates to people of other racial and ethnic backgrounds than themselves. If people are honest with themselves, they may find that they have some biases and stereotypes which can come from outside of the healthcare encounter into it, right in the smack dab in the middle of it, and have an impact on how they relate to and take care of that patient who is different from them. So we really want to make people aware of those differences and how they see people, and try to correct for them, try to rid themselves of those biases, and begin to find ways of communicating, doing role plays, that's an important part of it. How do you communicate with a person different from yourself to increase their trust level? There is a way that people can show by what they say and what they do that they care. And a patient who knows that their provider cares will do better. The relationship will be better, and we know the therapeutic relationship, that doctor-patient relationship, is really the critical ingredient, the key ingredient in getting a good outcome.
Well, one of the things that's very clear to me is that we are all affected by the society that we live in, by the culture that we live in, by this country, by the media representations and misrepresentations and all of those kinds of things. So certainly self-examination is very important. The other thing that's obvious is that we cannot train enough clinicians of color quickly enough so that this really is an issue that is going to become very important. Now, but let's also talk about some other things. I mean, that's some of the stuff that you're working on with the APA. What about some of the things that the mental health system needs to do, in your opinion, in terms of responding to the needs of people of color?
Well, I think the first thing that the system needs to do is to take a very honest look at what kind of care, the quality of care, are they providing to diverse populations. And one way to do that is to collect data by race and ethnicity, particularly data on outcomes. You know, how are people doing in treatment? You know, what's their level of satisfaction? You know, what's the level of disability, or how many people, you know, sort of achieve their treatment goals for different disorders like depression, anxiety, etc. And if that system finds that there are differences between, you know, people of European and African, Asian, Hispanic descent, that would be sort of a wake-up call for them to figure out, okay, where are we going wrong, and what do we need to do to fix it? We really need for people to take an honest look at that and just collect that information. That's the first step. And they may choose different approaches after that to institute cultural competence training, or to identify instruments that will help them in a standardized fashion make the right diagnosis. Those are some examples.
And one of the things that just struck me is just in terms of access to care. We have a system set up for the most part where people have to come in to an institution when they have a mental health need. If you think about some of the other things that are going on in terms of outreach, in terms of mobile teams, in terms of mobile treatment, in terms of taking the service to folks regardless of where they are, where they live. What about that in terms of the issue of getting to some of these populations?
I think doing that outreach or engaging people where they are, wherever they are located, is really key for diverse populations who have felt very much alienated from the system and therefore don't want to come to institutions. So I really encourage and have been fortunate enough to work myself doing that kind of outreach. It's very effective, and families of people with mental health needs really welcome you with open arms and appreciate that support. And often the outreach then opens the door to people to come to conventional sorts of services in clinics or health centers and so forth. So I think we need to invest more in the outreach if we really are serious about meeting the needs of these populations.
Well, one of the things that we know here, for instance, in Baltimore through our mental health crisis teams, is that going out to people, especially when they're in crisis and having a difficult time, and taking the service to them, especially if you can stabilize them in their home, community setting, and then link them and engage them with treatment, is that they're much more likely to participate. And it also is a way to kind of avoid institutionalization, which I would think that especially when you talk about African Americans and other minority communities is often what they see when they think about having a mental illness, think about going away to a psychiatric hospital, being locked away, being kept against your will, all of those kinds of things that are, historically accurate, but certainly don't reflect the real kind of spectrum of care that we have available to people now.
Well, that's correct, and there are it's not just a myth, It's also the reality that African Americans and other people of color experience more inpatient treatment and more involuntary inpatient treatment. And both of those things really are a turnoff for people with the mental health system. So anything that we can do to keep people, out of the hospital, in their communities, with their families and receiving care in an outpatient setting, that really is the ideal, and we should be doing whatever we can to make that happen.
Well, we can go on and on, but the other thing that I of course think about as well is some of the other projects that are going on in terms of training the police as another community resource. You talked about working with the clergy, but there's also a project that we have going on right now in Baltimore where we're training the police to be educated, expert responders to people, because often police are the first responders to people who are experiencing a psychiatric crisis. So, helping the police understand what to look for, what to look at, how to communicate with people in ways that tend to de-escalate the crisis, we have found has been very, very effective and often helps us avoid having to use involuntary means to coerce people into treatment. So there's a lot that we can do, and it just seems to me that even in spite of all that's going on, we've got a long way to go as a system of providers, as a system of actual caregivers, and the recipients of care certainly need to be educated as well. If we can make a difference in minority populations' willingness to not only access care and reach out for care, but also know what to look for, what to accept and not to accept, we've come a long way.
Yes.
And of course, as usual, when you are a guest on our show, we are running out of time. I feel like we could go on and on and on. You're a wealth of information. As always, I continue to be grateful and impressed by all of the things that you are doing, now doing things on a national level that are making a difference. And so I really appreciate your willingness to take time out of your busy schedule to spend some time with us here on Mental Health Matters. And thank you, viewing audience. And remember, when you or someone that you know needs help with a mental health or addictions crisis, you can call Baltimore Crisis Response Incorporated 24 hours a day at 410-433-5175. Thank you, and remember, your mental health matters to us.